Hello and welcome to Beyond Average Journeys Through Growth and Value interview series. And I'm your host, Kristen Carlson. And today I'm joined by Brandi Harless, CEO and co-founder at Prevent Scripts in Paducah, Kentucky. So Brandi, thank you for joining us today.
Yeah, thanks for having me.
Awesome. I'm excited to learn about Prevent Scripts. Can you tell us a little bit about your journey and how you started that?
Yeah, absolutely. About 10 years ago plus, I was living my life in the big city in Boston and had moved to DC and kind of swore I would never come back to my hometown of Paducah, Kentucky. This was just the place I came for the holidays to visit my family. And I ended up not liking working in a cubicle and really wanted to work in what in the public health world we call the field. And so I had spent about 6 months in West Africa during my public health days and decided I wanted to get back in the field. And so one of my good friends was running an organization down in Haiti. And we ended up writing a grant to the Pepsi Foundation and winning some funding for us to go do a project down there. And he essentially said, "Hey, well, now that we got the money, do you want to go do the project?" And I said, "Absolutely. Like, put me out there. I want to be in a community working." So I went down for our pre-planning trip, and it's a long story. It's probably not worth here at this podcast, but it didn't work out. I decided it wasn't the right move. If I was going to be in the field, it should be somewhere else with a different group. And so I kind of accidentally landed back in Kentucky. I didn't really know what I was going to do at that point, and I thought, well, I'll just stay here for a little while until I find my next job that's going to send me out of the country. But as I was here longer in my hometown, I always say I was starting to uncover the treasures that you don't see when you're a teenager. And so I went to buy a car, and my car dealer told me about this HIV/AIDS organization in my community, and I was dumbfounded. I said, "No way. There's no way there is such an organization in my community that I grew up in." Needless to say, yes, there was. And that was kind of my first journey into figuring out value that I could add to my own community. And about 5, 6, 7 years fast forward from that, I ended up working for an entrepreneurial development organization. And I don't even know how, to be honest. It's one of those serendipitous things of the right person at the right time asked me, right, to join them. And I met who is now my co-founder. She had moved back from St. Louis and was back home in her hometown and was trying to do a concierge practice. She's a pediatrician, and she wanted to do house calls, and that was a business she wanted to stand up. It was right when electronic health records were starting to become a thing, and she was a futurist, always has been. So I helped her and decided, okay, this isn't I actually figured out then that I had the entrepreneurial bug. And when I really took a moment to look around, I realized that I had entrepreneurs in my family. My grandparents were small business owners. My dad was a small business owner, and I'd never seen them that way before. And so that all kind of I think, prepped me for the moment when I had ran a free health clinic for a while and decided to go back to DC. And I didn't end up going. My cousin was actually killed in a hunting accident, and it really shook our whole family. And so I stayed back and thought I wanted to go to medical school. Well, I applied to 18 schools, and Natalie comes stomping at my door and says, "Don't go to medical school. You can't make a big difference that way. If you want to make big differences, like, don't do it one by one, patient by patient. Join me in this vision I have to really give primary care doctors tools and resources to get beyond themselves to help patients." And I said, "Well, that's not fair. You're already a doctor. Like, I should go to medical school." Well, I thought I was a pretty dang good candidate. I didn't get a single interview. I didn't go to medical school, and so I called her up and said, "I think you're right. Let's go for it." So we spent about 5 years really just learning about the market. And I had some funds from a house I sold in Nashville during the Nashville boom and was able to kind of self-fund that endeavor for us. And then in 2019, we finally found a value proposition and a business model that we thought would work in the healthcare space. And so we built a little MVP product and decided to go pilot it. And once we did that, it was kind of off to the races. And so we've since raised about $2 million in capital, and we're in the market, and we're working really hard to grow the company. And it's really fun to look back on how it's evolved over time, because the initial kind of vision was Natalie saying, hey, my patients are showing up using, if you remember that loseit.com website was one of the first like health websites that came out in the consumer world. And she said, they're showing up telling me they're using these things, but I don't have the data. I'm not providing that value to them. They're just doing it on their own. And so she wanted a way to help her patients do similar types of things, but also for it to be financially sustainable for her as a practice, but also meaningful for the patient-provider relationship. So I'll stop there, but that's kind of how we got to where we are at this point.
So what is that value your business is bringing to the marketplace?
Yeah, so we ultimately realized that even though in healthcare there's a lot of trendy conversations about what's called value-based care, where entities take risk for their patient populations and get paid for it, either on the upside or the downside. Even though that's kind of a trending topic, our provider customers are still getting paid in a fee-for-service model. So they do a transactional service, they bill insurance a code, they get paid for that code. So finally, when the remote patient monitoring CPT codes came online in 2019, did we really think we had something that we could actually get our customers financial value for? But over time, what's really interesting is that our entire platform is built on behavior change science. And so it's this concept of helping patients choose one small goal at a time to build a healthy lifestyle, and then to help them overcome barriers and identify what helps them, what doesn't help them, et cetera. And so now with the GLP-1 medications and with Noom being, a big known consumer company, we kind of have a little bit of a tailwind to be not tailwind, actually like a forward wind to be following, because there's so much interest now in helping patients do this healthy living thing. So right now, for every 100 patients that our providers enroll, they can see anywhere from $200,000 to $350,000 in additional revenue every year. So it's real money that they're able to bring to their practice, but they're also able to do the thing that I think a lot of primary care providers in particular have always wanted to do, which is provide proactive care, not just sick care. So it really meets that kind of sense of purpose along with the sense of financial need as well.
Right, so they're able, I mean, the goal is really to avoid having to get prescriptions, but actually change to a healthy living lifestyle.
Yeah, I mean, the prescriptions are the prescriptions. And I think there's a time and place for every prescription that is needed. With the GLP-1 medications, it's very well known now, and even the pharma companies say this, that healthy lifestyle coaching modification has to come along with the actual script as well. And so that's what's kind of driving that demand, I would say, the understanding that the medication is not magic on its own. And we kind of learned that about bariatric surgery also, that there's always been a behavioral modification piece of those protocols. What we really want to see is that it get implemented in a primary care setting across the board. So whether you're on the medication, whether you have hypertension, whether you're just pre-diabetic and you don't have diabetes yet, no matter where you are on that spectrum, you're getting the additional coaching support that is necessary to help build those healthy lifestyle changes, but that are specific to you, right? Not the big, massive, like I always say, we're not into the before and after pictures. This isn't about showing your abs and not showing your abs. This is about eating more vegetables and drinking more water and moving more.
Awesome. So your target client then really are these primary care physicians, and they can offer this to their customers or their patients, so they can have a healthier living, kind of a longer term guidance, right?
That's right.
Through their
Yep.
health journey. Excellent.
Yes. Mhm.
So you started in 2019. Where's your business at today? How big are you?
Yeah. So we have customers in Tennessee and in Kentucky. Our team is a combination of full-time employed and contracted staff still. I think overall, if we counted everybody involved, there's probably about 15 of us. We raised a seed financing round last summer, and we're now actually starting to talk about doing a seed extension round, because we've got a lot of interesting prospects kind of right there at the end that we're excited about. We have some opportunities to start to think a little bit bigger around the technology. So we're having conversations with the University of Kentucky Computer Science Department to help us consider what AI and machine learning can do, robotic automated RPA. I always get that term wrong. And so we brought on some advisors to help us think about what is kind of the next generation of our product look like. What's really great about, I think, what we've done from a platform perspective is that we're really focused on integrating into that clinic workflow, because the number one barrier or objection to any primary care provider taking on what we do is, I don't have time. I don't have time to touch a different thing. I don't have time to look at something different. And so we're working really hard to continue to improve on our goal to make it as seamless as possible. And I think a lot of these new technologies will help us do that.
So are you limited to Kentucky and Tennessee, or do you see this expanding across the country?
Yeah, no, we're not limited at all. We actually have chosen kind of our beachhead geography to be the southern states right nearest us, and then the lower Midwestern states. So there's 8 states that we're targeting, Kentucky and Tennessee being 2 of them, obviously, Alabama, Mississippi, Georgia, and then Illinois, Missouri, and Arkansas. So it's kind of our backyard, and we feel like we've built this product for people who live in more, we're in a small town. It's not a big city. And so we've built it for people who live in rural communities so we can solve for some of the challenges that are unique to that setting.
Awesome. So what are some of the challenges you have as you grow your business as the business leader?
It's a really good question. Recently I have, we really bootstrapped this company and spent our own money up until 2020, well, really 21, when we raised a pre-seed round to build our first version. And it has just dawned on me after now having done our seed round, I thought I knew what the ebbs and flows felt like, especially in an early company, but now I really understand what the ebbs and flows feel like. And the one challenge I think mostly is the challenge of figuring out how to truly involve and leverage all of the talent and minds that we've put around the business. I mean, if I were to show you the mind map of everyone involved at some point in time, between advisors that agreed to help us, to investors, to staff, et cetera, it's a big ecosystem that we put ourselves in the middle of. And I oftentimes am just like, I know it's there and I've got to figure out how to really use it. And I think that has become my most recent biggest challenge that I still don't quite have the answer to.
And your co-founder, I mean, she's probably working full-time as a doctor, so it's really you're in the center of this. Is that a true
Well,
statement?
actually, no, she actually was
Oh,
doing telehealth through COVID, and then she ended up
okay.
coming on with me.
Oh,
Took a big
perfect.
pay cut and came on with me full time. This last year and a half, 2 years. But we just recently kind of made the decision. I mean, she's our chief medical officer, so we just recently kind of made that decision of, okay, it's great that you were here for the 2 years to help us get over some humps. Now it's probably not as necessary to have a physician in the day to day. So I did have her. I don't now,
Okay.
but I did. And we
That
have a
might be
third
some of the challenge.
co-founder who's our chief technical officer. He's never been full-time. He's always been a co-founder along with us. So I think now I actually am starting to feel what you just mentioned, which is a little bit of the lonely side. But I have a chief operating officer who is incredible. And we have a couple other staff members as well. But it's definitely that strategic ping pong that I need. I don't have as often. And like I said, I have so many brilliant minds around me that
Right.
as a CEO, it's that constant tension of elevating yourself and staying in the big vision strategy mindset, and then getting the day to day done that I'm still responsible for, like, paying bills and filing paperwork. I mean, all those kinds of things. So I've been doing it for so long, you would think I would have a system. I don't have a system.
Okay. Yeah, and the challenge is how do you empower those that you have helping you to take that on, to really
That's right.
freely love. So
Yeah.
excellent.
I
So
pride myself in being a decent delegator. I do think I'm decent at it. I think what I'm really wondering about these days is like, if I can't get myself elevated to the strategy level by myself, how do I involve all those other people that I was mentioning in my ecosystem?
right.
And, what does that look like? How frequently do I do that, et cetera?
Excellent. So working with your team there, what are you thinking about how to take your business beyond average and get it to best in class?
Uh, so I have to tell you, I noticed that question in your email to me, and I actually didn't have an answer until right now. It just dawned on
Okay,
me.
perfect.
So I I was talking to one of our board members. We're a small board right now, and he was reminding me of the flywheel concept from Good to Great.
Mhm.
And I read that book a long, long, long time ago, a long time ago. And it was one of those times in life when you read something and you're like, I get it. I love reading about this, but this isn't relevant to me right now, you know? So him just saying that put me on this kind of rabbit trail that I went down on the Good to Great concept. And I ran across the hedgehog concept. Have you read this? I'm assuming you've read this book.
Probably, yeah. The
Jim
good to great.
Collins.
Oh,
Yeah,
yes.
Good to Great.
Yes,
Yeah.
yes.
So I came across the hedgehog concept. And the hedgehog concept is this idea, right? That what is the phrase? The fox knows a little about everything, and the hedgehog knows one big thing. And so he encourages you to consider these three big questions. The first is, what is your team uniquely capable of being the best in the world at? What is your passion that like there's nothing else that could push you away from it? And then what's your economic driver, right? Those are the three pieces. So I have ironically been thinking about this a lot, and your question was the best in the world question. And I realized that for us, the best in the world is two things that are really important. We have a two-sided market in some ways. Providers and provider engagement is critical to our success, but also is patient engagement and patient success. And on the provider side, there's this hesitancy to take on new technology projects, new things in the practice. And I believe that the thing that we can be and will be best in class at is finding the ways to simplify the implementation and rollout and embeddedness into the clinical workflow in primary care. I believe we will land there, and it will give us such an opportunity to be a true platform that other solutions can plug into because we have truly solved for the difficulty of doing that. On the patient side, it's the passion and the desire to be best in class at finally switching the conversation from patients don't want to change, people don't want to change, people don't want to get healthy, to let's look at the behavior change science and let's level the playing field because people don't have access to the science and to the tactics that do work. And that's more reason why they're not able to be successful than anything. And so those are the two things that I believe we're going to be best in class in, is to operationalize behavior change science in the clinical setting and to truly integrate that whole clinical protocol into the primary care setting.
That was beautiful.
Long
Well
answer,
said.
but
No, well said. And I think that as we age, I mean, we have to find ways to do things different. We can't all live on, fast food and soda anymore, and we've got to change our ways. So this
yeah.
sounds like a great opportunity, and it definitely sounds like it could explode, and get much bigger than just the states you're thinking about. So. Thank you, and thank you for sharing this with everyone today. It was great to learn about your journey. Very excited about your business and your growth potential. And thank you for joining us today, Brandi.
Yeah, well, thank you for having me.
Awesome. And I look forward to everyone joining us on our next episode.